Welcome back, everyone, to Neil Oliver Live. A British doctor is among a group of international experts asking the High Court in South Africa for a judicial review of the products Pfizer pushed as COVID vaccines. Consultant cardiologist Aseem Malhotra says the so-called vaccines are harmful and must be withdrawn before any more harm is done. If the case is successful, the products may be pooled in South Africa, with obvious implications for countries around the world that have used and are still using these gene therapies. Aseem joins me now. Hello, Aseem.
Hi, Neil.
It's great to see you again.
Likewise.
Before we get into the specifics of the South African case, just bring us up to date. You've been on this journey with the vaccine and the rollout and COVID from the beginning. Yeah. Where are we most recently?
Really good question, Neil. So I think in terms of the scientific evidence, certainly I think two key things have happened in the last couple of months that I think really draw more light on this major concern on something which I have described as the greatest miscarriage of medical science that we've ever witnessed. First and foremost, Norman Fenton, who you may know, Professor of Risk, he did his own analyses. You know, he's very rigorous, looking at the excess deaths and trying to make some calculations as to what proportion of these excess deaths that are ongoing in Britain, that we know about, which is still a problem, are because of the vaccines. And even I was quite shocked by his figure. I wasn't expecting it to be that high, but he came up with 50%, about half of all the excess deaths are likely either directly or indirectly because of the COVID vaccines.
Goodness me.
Now, on top of that, a very interesting publication in America, BMC Infectious Diseases also, which came out last couple of months. Slightly different study, but very fascinating, was really a kind of survey study of Americans looking at how, you know, of the people that were vaccinated or people that knew people that were vaccinated, how many of those felt that they had vaccine injuries, either themselves or friends or family, or died because of the vaccine. And they were able to come up with a figure suggesting that there may be as many as, in 2021 alone, 278,000 fatalities purely because of the COVID vaccines. And of course, in America, they mainly used Moderna and Pfizer, so mRNA vaccines, which is pretty extraordinary. That gives a figure about 1 in 1,000 in terms of death rate, and serious adverse events about 1 million people, which would give a figure of 1 in 300. Now, critics would say, well, this isn't a randomized study, blah, blah. We can talk about that later, all the other evidence. But what I would say is, you know, in medicine, we're taught as doctors that 80% of your diagnosis comes from the history. That means what the patient tells you. If you listen to your patient, most of the time, you will get the answer of what's wrong with them. So I would say this is almost an analogy to that kind of process. But either way, Neil, it's a big, big issue.
Tell us what it is that's happening in South Africa and I suppose particularly why it matters to us here and to people all over the world.
Yes, so this is a landmark case brought by a grassroots organisation called FASA, Freedom Alliance of South Africa, which is made up of doctors, teachers, activists, even lawyers, etc. And they have filed this case against the government of South Africa and the medical regulator, specifically saying that the original approval of these COVID, specifically this Pfizer vaccine, that was what was used predominantly in South Africa, was irrational. Irrational because, I mean, it sounds obvious now, that the data all came from Pfizer, it was analysed by Pfizer, the results were done by Pfizer, and therefore it was unlawful. But a number of international scientists, including many of repute in South Africa themselves, have determined, with all the information that we have in a 700-page document, that the vaccine is clearly unsafe and ineffective. And of course, yes.
And this is based on, I feel the need to stress, it's Pfizer's own data. So Pfizer's own data made clear, even before the vaccine was rolled out to the general public, that it wasn't safe.
Yeah.
It's all there in that paperwork.
Yeah, it's a great question, Neil. So it's definitely part of the evidence. That brings us on to something else, which is really important. So I think one of the things that's important about this court case that will happen very soon is that it allows people, and it'll be for public consumption, to look at all of the evidence. As you know, one of the problems that we've had in this whole pandemic is the narrative has been very narrow. It's been very much controlled by these powerful vested interests. The media have been pushing this message of safe and effective. And what it will do is it will cut through all of that so people can see all the evidence. And I know very clearly that that evidence is extremely concerning in terms of the harms and the safety of the vaccine.
May I ask a question?
Yeah.
As a medic, before your father passed away, I'm so sorry to hear that as well, that was your turning point, but if that hadn't happened, you would have still been all for the vaccinations. So it took your father's death to make you kind of open your eyes?
It's a great question, Narinder. So I think my historical approach to medicine would contradict that in the sense that my father's death was part of it.
Right.
But actually the evidence came to me where I realised, and then it was clinical experience and everything, and looking at the evidence itself. So I think that was definitely part of it. But, you know, I've been the whistleblower on the harms of sugar, on statins, over prescription stuff. So I've been doing this for a long time. But just coming back to this point, Neil, it's really important around looking at all the evidence. One of the things that's going to come out, I think, in this case is how the media have presented one side of the story. Now, already, what's really interesting, in South Africa, I would say that the empire is starting to strike back. So yesterday, on one of their mainstream channels, ENCA, without any people on the side of, you know, giving both sides of the argument, they rolled out a professor of constitutional law, Pierre de Vos, from the University of Cape Town, who apparently said that he had read all 700 pages of this document, and they asked him, what did you think of it? And he said, well, basically, it was always making a mockery of the case by suggesting that the evidence was based upon anecdotes. Say, someone had the vaccine and they felt a bit dizzy afterwards. So when I saw that, I was actually embarrassed. I was embarrassed for him. I was embarrassed for the University of Cape Town, and I was embarrassed for constitutional lawyers, because clearly he hasn't read the evidence, and to suggest something like that really makes a mockery of the vaccine injured. Now, very quickly on this, Neil, what's really important, so you asked me the question early on. When you look at the evidence, we are not talking about anecdotes here or low-quality evidence. We're talking about Pfizer's own data, reanalysis, what we call double-blinded randomized controlled trial data, highest quality evidence, suggested from the beginning it was going to do more harm than good. More serious adverse events for people in the vaccine group than people hospitalized with COVID. So that was already suggesting it probably, if it was analysed properly at the beginning, should never have been enrolled or given to a single human in the first place. Pharmacovigilance data, VARS in the United States, yellow card scheme here, very horrific, unprecedented levels of reports there. Clinical data, observational data, autopsy data. In my whole career in medicine, Neil, with all the analysis, academic work I've done looking at all different areas of medicine, specifically also related to cardiovascular disease, I've never seen such a high, overwhelming quality of evidence of harm of any drug and such poor efficacy. Now, with all of that, to be fair to Professor Vos, I think we also have to have some compassion for people, understanding that why are people not awake? Why are people not looking at the evidence? Some of it is indoctrination. Some of it is willful blindness. But there's something else which I think we haven't talked about enough. One of the serious adverse effects from the vaccine, from Pfizer's own trial, Neil, in their own trial, in the reanalysis, and in the World Health Organization endorsed list of potential serious adverse effects, is psychosis. So some people, I think, are actually suffering from a side effect, which I would call delusion of benefit. Okay, let's define delusion. A fixed, firm, false belief that is held despite evidence to the contrary. And the evidence, Neil, is overwhelming. This vaccine is not safe and is not effective, and it needs to be stopped and pulled now. And the longer the establishment and carry on pushing this message, the longer it's going to take to regain trust.
Going to have to leave that there. Obviously, this is such a long conversation to keep going on with. I'm going to have to leave it there. Aseem Malhotra, thank you so much for coming in tonight, and we'll be coming back to you in the future, I'm sure. Coming next on Neil Oliver Live, I'll be talking more about this issue with Jay Naidoo, an elder statesman of South African politics who was one of Nelson Mandela's most trusted supporters and advisors. Don't go away, and Aseem will be staying with us for that conversation with Jay.